So now what about treatment? Now early identification of the triggers as mentioned earlier, avoidance of those triggers are form one of the most important treatment aspects in asthma. Now you have a bronchoconstriction, so in order to bring back this narrow airway to the previous state, you need some medications, and the most important medications that is prescribed include inhalers. The inhalers can occur in the form of a spray, or it can be in the form of some capsules. So it can be in the form of capsules. So usually these sprays are known as metered dose inhaler, where a fixed dose is emitted during each puff, and it is always better that you take the inhaler with a what is known as a spacer. This is just like a bottle. That the advantage of using a spacer is to prevent wastage of the spray to outside. It also will reduce deposition of the inhaled medications in the mouth, and it will increase the lung deposition, so that the effectiveness is more. So the advantages of inhalational therapy is that the drug is directly delivered into the respiratory system. The action is quite fast, and the side effects are far less when compared to systemic therapy like tablets or injections, because it does not go to other organs. Now many patients will have the question as to, will I get addicted to the spray? That is one of the common doubts that patients ask when they are prescribed inhalers. But there is nothing addictive in this. This contains just medicines to dilate your airways. So because asthma is a chronic disease, you may have to use the medicines for long. So it is only because of the nature of the disease that you are prescribed this medicine for a longer period. It is not because of the addiction liability. Just keep that point in mind, and there need not be any worries in your mind in using inhalers. The only thing is you need to gargle your mouth well after using the inhaler. So then for home monitoring of asthma, you may be given this simple instrument which is known as peak flow meter, which again measures your blowing capacity, where you have a metered you have a meter and you have an indicator which measures your blowing rate or your blowing capacity. So if at this you need to do it daily. It's easily available in the market. So if you buy this and you use this daily, then if there is any change in your blowing capacity from your normalcy, then that indicates that you are having some problem with the your airways. So you need to take appropriate treatment appropriately. So in addition to that, in addition to all these medications, again I told identification of allergens and avoidance of allergens also is of paramount importance. Now sometimes the asthmatics can present with a very severe acute attack, the so-called asthma exacerbations. So these patients will end up in hospital, and they will require injections or nebulizations, and sometimes even ICU admissions may require, but that is in the natural course of the disease. So with appropriate treatment, that also can be settled.